Welcome to the third and last video of this series. My name is Tevin Henry and my pronouns are he, him. In this video, we're going to talk about health disparities among the LGBTQ community, risk factors for substance use problems, common dual diagnosis, treatment options with higher levels of efficacy, and important information to know about substance use rates across the U.S. Let's begin with a definition. According to the National Institute of Health, health disparities are the differences that exist among specific population groups in the attainment of full health potential. These health differences are preventable and stem from systemic inequities that are often experienced by socially disadvantaged populations. Research suggests that queer individuals face health disparities that are linked to societal stigma, discrimination, and denial of their civil and human rights. The discrimination and stigma that the queer population has had to endure has been associated with high rates of mental health issues such as anxiety, depression, and social phobia, substance use problems, and suicide. Experiences of violence and victimization are frequent occurrences in this group and have long-lasting effects on the individual and community levels. Moreover, despite the fact that the queer community has had to endure discrimination and rejection practices from society for many decades, it wasn't until 2016 that the NIH formally designated the LGBTQ community as a health disparity population. The structural, cultural, and systemic challenges in our society have created barriers for minority populations to access healthcare services. These barriers to care and result lead to negative health outcomes and to an increase in health disparities among those affected. The omission of sensitivity principles in the healthcare system is one of the main factors as to why minority populations do not seek medical services, and when they do, perceptions of rejection in unsafe spaces lead them to refrain from services, resulting in worse health outcomes. Research is consistent in showing that little to no social and community support, isolation, adverse childhood experiences, history of violence, and experiencing a constant rate of rejection and discrimination are the leading risk factors that contribute to mental health issues and disorders such as anxiety, depression, and substance use. Although there are higher rates of substance use problems among minority groups, especially among queer individuals, this health outcome must not be seen as a behavior problem associated to the individual. Rather, substance use in this context must be seen as self-medication mechanism that the person employs to cope with layers of stigmatization. In other words, addiction must be understood as a symptom of trauma. When it comes to substance use treatments, there is no one-size-fits-all. In fact, there's a variety of different treatment options that are used in different modalities. The modality of use is decided based on specific needs of the individual seeking help. Moreover, treatment approaches must fit to the patient and not the other way around. Treatment options show higher levels of efficacy when they are adapted to the minority group based on their social context and risk factors to addiction. According to the published literature, the treatment approaches that were shown to have higher levels of efficacy when treating substance use problems and other mental health issues among the LGBTQ population are cognitive behavior therapy, eye movement desensitization, reprocessing therapy, motivational interviewing, harm reduction approaches, and trauma-informed treatment. Let's go over a couple of these to understand why they have better treatment outcomes when used on queer patients. EMDR is a psychotherapy treatment that facilitates the assessing and processing of traumatic memories and other adverse life experiences to bring these to the adaptive resolution. EMDR has yielded positive treatment outcomes for treating PTSD, depressive and anxiety symptoms, positive behavior changes, and decrease in addiction severity. Trauma-informed care is an approach that recognizes the presence of trauma symptoms and the role that trauma plays in the individual's life. Trauma-informed care considers the extensive nature of trauma during the recovery process and promotes environments of healing. This approach has high levels on efficacy when used with LGBTQ patients and should be implemented in combination with other treatment practices. Trauma, a risk factor for addiction, affects each individual differently. Remember when we mentioned that it is important to understand the individual's needs to provide adequate care? Well, trauma-informed care brings that framework to the therapy session, and in the context of LGBTQ patients, the acknowledgement of symptoms and consequences of trauma allows for a trusting and safe environment in which the patient will have better opportunities to thrive in their treatment and recovery process. Traditionally, the health of queer individuals has been focused primarily on risk. That is, higher levels of engagement in risk-taking behavior perpetuating a continuum of discrimination, victimization, and harassment toward this population as a result of homophobia and transphobia. When it comes to LGBTQ health, these issues serve as barriers to care that then lead to negative health outcomes and an increase in health disparities among this population. I want to bring back the concept of addiction being a symptom of trauma. Queer folks are at greater risk of living in unhealthy and mentally draining environments due to lack of support and cultural stigma. What happens when other factors come into play? Factors such as race, language, culture, religion, age, disability, physical and mental health. Addiction is a mental health problem that is highly stigmatized by society. What happens when all of these factors intersect? And more importantly, what can we do to reduce this stigma? You can help provide a safe space for your queer patients who are struggling with mental health issues that result from trauma. By adapting the delivery of your services and employing the tools and resources that were discussed in the previous videos, you can offer a life-changing opportunity to members of the community. Providing a safe space where a queer person can feel welcome, understood, accepted, and supported can make a difference in their treatment and recovery process. A difference that can save their lives.